Hi, my name is Kieran Leong, and I am a pediatric cardiac and adult intensive care physician at the University of North Carolina. I was a member of the Innovations Fellow class from 2018 to 2019. At the time, I was a pediatric cardiology fellow, and I was really interested in pursuing a research pathway that expanded my knowledge beyond the typical research and clinical work into areas that could really influence patient care on a broader level. And the Innovations Fellowship program really offered um, a really unique experience that was essential in my career. I worked on four main projects as an innovation fellow, one being reducing mortality in ARDS through increasing prone positioning, the second being continuous non-invasive cardiac output monitoring in post-op congenital heart patients, and the third and fourth projects were involving pain management in pancreatic patients as well, pancreatic cancer patients, as well as home diagnostics in cancer patients. It was pretty unique being able to interact with so many people from such a broad experience. And our boot camp through the fellowship program really offered a nice introductory exposure to regulatory um, processes, through reimbursement, and through medical device design itself. And I think the fellowship offered all the resources that you need to in order to develop one, an interest, and two, to bring your medical device or design into practice. It was pretty amazing the access that we had during the fellowship, whether it was clinical access through physicians through the university or a broader extension, whether it's going to the OR, whether you were talking to FDA regulatory advisors, reimbursement advisors. And I never thought I would have the ability to interact with those people at such a close level. And I think the process really shaped my interest in not just pushing clinical care, but also coming up with processes that could help patients on a larger level. And I think this really helped me succeed when I pursued further clinical training in critical care. And when I went and interviewed, program directors and other faculty would comment on it and were really intrigued by the process. And I think that gave me a leg up while applying for more training. Ultimately, um, this experience was pretty transformative and helped, I think, me come up with innovative solutions for really challenging situations that we encountered in the COVID-19 pandemic when we had to adapt and think outside the box. And I'm thrilled I had this experience, and I would encourage anyone with a clinical background or otherwise to pursue training in this fellowship. It was pretty amazing, and I wish you all the best.